Hello and welcome to Pisgah Health Today. My name is Angela Owen and it's my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals committed to improving the health, wellness, and lives of Western North Carolina residents. Our special guest today is Scott Buchanan, who is the president and CEO of WNC Bridge Foundation. Welcome to our program today, Scott. Before Scott joined WNC Bridge Foundation, he held a host of roles at Care Partners Foundation, including the former president and CEO there. He has also been the director of the brain injury program at Thomas Rehabilitation Hospital. And as we were jumping on here, talked about he is a Gamecock, a former alum or current alum of the University of South Carolina, Columbia. Again, welcome to our program today, Scott. And why don't you start by just telling us a little bit about what is WNC Bridge Foundation?
Thanks, Angela, and we deeply appreciate you asking us to be a part of the Pisgah Health Foundation's web broadcast. WNC Bridge Foundation is not necessarily a new foundation. It's a new name for a former foundation. We were, up until 2019, the Care Partners Foundation, and that had been around in many variations from Tom's Rehabilitation Hospital Foundation. We added on Mountain Area Hospice Foundation, joined in with it. It became Care Partners Foundation in 2003. And then in 2019, with the sale of Care Partners Mission to HCA, Care Partners Foundation became WNC Bridge Foundation, and we changed our focus. Up until January of 2019, we had focused all of our efforts on supporting the programs of Care Partners, which were a rehabilitation hospital, a hospice program, home care programs, orthotics and prosthetics, adult daycare, outpatient rehabilitation. So all of these large healthcare programs, the foundation supported. We built buildings, we owned property, we did a lot of things a little differently. In 2019, with the sale of Mission and Care Partners to HCA, we became a fairly unique foundation. We had a decent collection of assets. We were dedicated then to serving all of the 18 counties of Western North Carolina, not just the area that Care Partners had served before. We kept our same board. We moved away from the Care Partners campus and are building a brand new office building right now in South Asheville that we're going to be in. Our prime focus right now are in 3 areas. We're looking at elder care, we look at youth development, and we look at health and wellness. And those are impact grants. These are large grants of $100,000 or so. We have smaller grants, $10,000 and below. We give out 40 to 50 of those a year to small nonprofits. And just this year, we've taken on a new focus with what we call our AIM grants. We are looking throughout Western North Carolina. We are looking at locations that maybe have substandard housing, that need home repairs. And we're also looking at increasing food security. And so we have a brand new program that we're going to be working with other nonprofits on. So we were spread across all 18 counties. We try to focus on strong partnerships with other organizations. So we not only look at nonprofits, but we also look at our relationship with Dogwood. And then we also look at our relationship with other legacy foundations, such as Pisgah Health Foundation, who is an important partner with us in looking at those counties that Pisgah Health Foundation serves. So that's kind of in a nutshell who we are and what we've been doing. Most of our staff were former Care Partners Foundation employees that we brought over. We make our funds off of donations. We make them off of retail operations. We own thrift stores. We have an estate sales program. We have investment income from our portfolio. So we're a very diverse community charity foundation. And we try to serve as many people as possible, whether they're an individual. We have a program called You're Special. And this is a program where a clinician, nurse, social worker, doctor's office can call us on the phone and say, I've got a patient who needs medications, who needs medical equipment, who needs assistance staying safely in their home. And so we serve over 1,000 people a year, just individuals alone with that program, plus our impact grants. So last year, I think we gave away around $7 million back into the community there. But we are growing. We hope we're doing the right things. It's hard to say sometimes, but we do work with I think about 200 nonprofits and schools last year.
The impact is amazing. I'm tired just listening to
Sure.
you describe everything that's happening. And here's what I find to be very curious in my own personal reaction. I hear all of the great programs and it feels, so daunting in many ways, the impact and the footprint that you have. And then you bring it into the individual with that you're special. And I think that says a lot, Scott, that
Sure.
the individual is not lost. And in fact, the focal point of so much of what you're doing. That is absolutely amazing. And so thank you for the history. I certainly learned something there on how Care Partners transitioned in and you took that refocus. Well, you mentioned the partnership with the Legacy Foundation. So tell us a little more about that partnership, specifically in this case with Pisgah Health Foundation. And how is that partnership helping you in meeting the needs across a portion or all of those 18 counties that you serve?
Sure. When the Legacy Foundations were brought into fruition, we became sort of a partner with them. Even though we were an established foundation, we developed a relationship and we started meeting with the other foundations. And we found that we had a real kinship, that we had common purposes. We wanted to serve some of the same people. And one of our closest partnerships is with Pisgah Health Foundation. With Lex Green and his staff, we knew them from prior times, and we communicate regularly with them. We share information about projects that we're working on and try to find sort of some joint opportunities there. The most impactful one in the last year or so has been the contribution that came from Pisgah Health Foundation to help us support Rathbun House. Rathbun House is a hospitality house, the only one in Western North Carolina. It's a 36-room house that previously was under the control and responsibility of Mission Health Foundation. Well, when HCA bought Mission Health Foundation went away, and they were looking for an organization that was a nonprofit and had enough size and capability to it to take on the responsibility of Rathbun House. So now it's 100% owned by the WNC Bridge Foundation. We have assumed all financial responsibility, but it serves all 18 counties. Anybody that's getting healthcare in the Asheville area and needs a place to stay, a family member, can contact the Rathbun House and we can give them a place to stay for free. So we get folks from the area that's served by Pisgah Health Foundation. So Lex Green stepped up and gave a very generous gift from Pisgah Health Foundation to help us fund that program, though. So he recognized that folks in his community and in the communities that were served by Pisgah Health Foundation were utilizing those services. And so he wanted to make sure that we knew that he was a partner with us and that he wanted to recognize that he wanted to help his neighbors and his community when they were in the Asheville area and needed a place to stay. So that was a very generous gift. And he was one of the first Legacy Foundations to come forward and make that gift to help us out.
I can personally attest to the importance of a house like that, as I had a family member in another community where we needed to do some medical care and some travel. And so that's a really, really important need that you're meeting there with it. So that is amazing. Talk to me, Scott, about, tell the audience more. How can they find you? How can they come alongside you? How can they get involved? What else would just be important for them to know and understand, especially if you, as you have taken this organization, this foundation, and you've pivoted into this focus with the impact grants and then the smaller ones as well?
Well, they can always find us on wncbridge.org. they can give us a call here. Currently, we're located in the Arden area on Hendersonville Road. Big sign out on Hendersonville Road. They can stop by and see us. Our new building is just going to be about 1.5 miles down the road, right across from SD's Elementary School on Overlook Road. But we also want people just to contact us to give us information. Is there a need in your community? Do you see a nonprofit that's struggling? Do you see an individual that you know that's struggling? Do you know of an organization who wants to do good things but doesn't have the infrastructure or maybe the capacity at this time that you can bring to us and we can talk to? So that's information that we need and partnerships that we want to be out there. Most of our folks all live in the Asheville area. We don't know everything in Western North Carolina, but we know that there are organizations and people out there that do know what those needs are in their community. You can also volunteer with us. As I said, we have retail operations. We have thrift stores and estate sales programs that are, we take all the funding that we make on those retail operations there. We use it to fund that Your Special program. We also have another program called WNC Greatest Needs, where if you need home repairs done, or maybe you need a large piece of equipment for your home, or you need a air conditioning unit or something like that, we have that fund also. And so the profits from the retail operations help fund those programs. And we have a multitude of volunteer opportunities just with those programs there. We also want to have more representation on our board from people across Western North Carolina. As I said before, when we were only serving Care Partners Health Services, most of our board were all just localized right here in the Buncombe County area. We had someone from Transylvania, we had someone from Henderson, we had someone from over in Haywood, but we want to have our board represent everyone in Western North Carolina. So people that are interested in being a part of our organization, I would love to be able to talk to them and learn from them. So anything that anybody can participate with us. We also have a great fundraiser, and it's not really a fundraiser for us. We have dragon boat racing on Lake Julian, which is right here in South Asheville. And this will be our 5th year of doing it. Last year was a virtual event. This year, we hope in August, it's going to be a real event. And what we do is we have nonprofits in the community that come to us and say, will you help me raise money? And so this year, there are 3 nonprofits that are going to be working with us. We have 500 to 600 people that attend there. We have 350 people that are actually in different boats rowing. It's a competition thing. We have a dragon boat company out of Knoxville that comes and brings 20-person rowers with 1 drummer and 1 steerer boats here. It's a great fun day, but we take all the proceeds and all the money that's made and we divide it up with the nonprofits, and we don't keep any for ourselves. So, but we use a lot of volunteers that day, but it's a great day and it's a fun all-day event. So if someone's interested in just learning more about dragon boat racing, it's the only one that we know of in Western North Carolina, and we'd be happy to have anybody come out and join us.
Lots of ways to get involved, and that day certainly sounds like a ton of fun with a great purpose behind it along the way there. So, and I appreciate the invitation that you extended to everyone to come and share information about those needs, but both at the nonprofit and the individual level. Well, Scott, let me say thank you on behalf of the board of directors at the Pisgah Health Foundation. Thank you to you, the rest of your team, and all of the volunteers that work so diligently through WNC Bridge Foundation to make such a difference across our 18-county community. We are super grateful, and thank you for taking time to join me here today to tell a little bit of the story on Pisgah Health Today.
Thanks, Angela.
We also want to say thank you to Wildflower Media for their creative and technical support. And we would like to say thank you to the staff and the board of directors at Pisgah Health Foundation for their diligent work to bring health and wellness to the community at large. Also to say thank you to the Physicians Roundtable. If you liked this story and you would like to support stories like this and others, let me encourage you to go to pisgahhealthinsiders.org and join the movement. While you're here, like and share that video with friends. Make sure that you share the story here of WNC Bridge Foundation so that others can know about the amazing work they do. And so we see you on the next Pisgah Health Today. Stay well and be well.